Good morning, everybody. Great to see you. Thanks for checking in today. So last week, we made a pretty exciting announcement about our economic recovery efforts. As you know, we've been transitioning into really planning and long-range efforts to recover our economy and our communities as COVID passes us, hopefully. We really value businesses in our county, small businesses in particular, provide starter jobs, new jobs, full-time jobs, get people set on career paths, give entrepreneurs opportunities to really develop their dreams, and just fill a lot of community needs. So small business in particular have been really hard hit by the pandemic and the sort of resulting economic dislocation that we've had. So we're focusing a lot of our efforts on small businesses as well as large businesses. But so we announced that we're investing $5 million to support businesses and workers and give a boost to the community. So just over $2 million will be invested in an expansion of our tourism sector, so we can draw more visitors to support our local businesses. And this really goes beyond tourism. Many of our agricultural businesses in the county are teamed up with tourism and agritourism. That's become a really big part of our agricultural industry also. So I think regionally, if you think of the Tulip Festival, tourism and agriculture can really go well hand in hand. So another $3 million will be used to create a small business innovation assistance program, and it's going to help really give new startup businesses and entrepreneurs a startup, and we'll be providing not only financial assistance, but technical assistance and navigation services for those entrepreneurs and new businesses. So we expect these programs are going to be available this summer. And you just stay tuned, and if you want to check out more details of not only this program or these programs, but also in general our recovery efforts, you can check our Snohomish County Office of Recovery and Resilience webpage. So thanks for that, and that's all I have this morning. With that, I'll turn it over to Dr. Spitters.
Okay, thank you, Executive Summers, and good morning, everyone. Thank you for joining us. I'm going to share a couple of slides as I speak here. I'll try to speak and share them in sequence well. But first, let me get that up here. So I want to talk today about increasing voluntary prevention efforts to address the rise we're seeing in cases and hospitalization. And as part of that, I'm recommending that people of Snohomish County return to higher levels of caution around COVID. You can see on this first slide, I'm showing you the case counts over time, and you'll see that the case counts over the past 2 weeks increased from 1255 for the week ending April 23 to 2819, more than doubling the week ending last Saturday, April 30. That corresponds to a 7-day case rate of increase from 155 to 336 cases per 100,000 for the 7 days ending April 30. More concerning than the case rate is the fact that we've seen the rate of new hospital admissions for COVID more than double in the past several weeks. And during that same time, the number of COVID positive patients in hospital beds in Snohomish County more than doubled from 15 to 35. That's an increase from 2% of hospital beds to 5%. Taken together, these data show Snohomish County having moved from a low to a medium community level of COVID as defined by the Federal Centers for Disease Control and Prevention. So this is a reminder that although we may be in a new phase of the pandemic, we are not rid of COVID. If we continue to see hospitalizations increase, we'll find ourselves in a high-risk level with yet another healthcare surge, burdening a short-staffed and exhausted healthcare system and compromising access to inpatient and outpatient care for all. We're learning to live with the presence of COVID long-term as we live with many other communicable diseases. That doesn't mean COVID is any less serious of a disease. There will be ups and downs in transmission and healthcare impacts over time, and we must adapt to reduce the impacts when those waves hit and do so before we're in a crisis. It appears we are on the front end of such a wave now. Hospitals and outpatient healthcare systems are again beginning to feel the strain of increased COVID cases in walk-in, urgent care, emergency, and inpatient settings. Cases and outbreaks in long-term care are picking up again as well. We need to do what we can to prevent severe disease, disability, and death, and to conserve the capacity of our healthcare system to provide care for all conditions. This is why I'm recommending increased COVID prevention measures for all. First, get up to date on your vaccinations. If you have not been vaccinated against COVID, the vaccine is still available at no cost from healthcare providers and pharmacies. If you have been vaccinated, make sure you have gotten all the recommended booster doses as well. That means at least one booster dose for everyone who's completed their initial series, and an additional booster dose for those who are age 50 or older, or who have certain underlying conditions and are under age 50. If you're not sure whether you need a booster, please talk with your healthcare provider. Being up to date with boosters extends the period of protection against infection into the future, protects against severe illness, hospitalization, and death. It also broadens immunity to fight future variants. The benefits of getting boosted far outweigh the risks, especially for older adults and people with risk factors for severe disease. And yet only 55% of our booster eligible fully vaccinated people in the county have indeed gotten boosted. I also urge all of us to put our masks back on in indoor public spaces and any outdoor settings where distancing isn't possible. Masks may not be required in all venues, but you can wear them by choice. They are an effective tool for disrupting transmission, and masks are most effective when their use is widespread. Most mask requirements were lifted here in early March, just about 2 weeks before the increase in cases started. Decreased mask usage also certainly played into our increase, along with the rise of the BA.2 subvariant, the relative of Omicron, as well as incomplete vaccination or waning immunity. So I would suggest that instead of thinking masks optional, as I've seen written on many signs around the county, we think masks strongly recommended, as our community has slid into this medium risk level. We're also seeing more gatherings and events occurring. This is the time to be careful with those. Do not attend if you feel sick. Instead, stay home and get tested. If you're at higher risk for severe illness or share a household with someone who is high risk, please take extra precautions. I would encourage everyone, regardless of age or underlying conditions, to keep gathering small and look for opportunities to gather outdoors rather than indoors, or if you must be indoors, to use windows and doors to improve ventilation and circulate the air better. Fortunately, there are also new therapies available to help reduce the severity of illness due to COVID and prevent death, hospitalization and death for high-risk patients that have been diagnosed with COVID. If you are someone who is over age 65 or of any age with risk factors for severe illness, talk to your medical provider right away if you test positive. You can also look for U.S. Public Health Service sponsored test to treat services, and we'll put that link, the link to that treatment site finder in the chat. Remember, though, that these therapies are not a substitute for preventive measures, namely being vaccinated and boosted against COVID and masking up in indoor settings when outside your home. So, in summary, I'm recommending that the residents of Snohomish County get vaccinated and boosted, be up to date, voluntarily mask up indoors, even where it's not required, isolate and get tested if you have any symptoms, and modify plans for events or gatherings, such as moving them outdoors or keeping windows or doors open to reduce the spread of COVID. All of this is part of learning to live with COVID. It's not about waiting for the pandemic to be over because COVID's not going away in the near future. We must learn to adapt our strategies when needed and work as a community to reduce the dangerous impacts of COVID surges as we see them approaching. So thanks for your attention. And with that, I'll turn it back over to Executive Summers.
Thank you, Dr. Spitters. I'm going to use my prerogative here. This is something we haven't talked about in quite some time, but do we have any data yet about the reinfection rate or ability? I know early on we talked about not knowing whether this COVID virus was something where you're kind of one and done, or whether it was going to be reoccurring like colds and flu, and many other diseases are. Do we have any data yet, or is it still too soon to tell?
Well, reinfections are rare. I can, before we're done here, I'll post the link to the reinfection report that's put out weekly by the state. Early on in the pandemic, it was exceedingly unusual to have a reinfection because the immunity provided by reinfection also wanes with time, not only with this coronavirus, but with the other ones that are circulating and not causing a pandemic, but do cause common colds or respiratory illnesses. We can get reinfected with those. And as time passes and the immunity wanes, whether it's from previous illness or from vaccination, you can get infected again. So getting vaccinated, even if you've been infected before, helps reduce your chances of reinfection, but more importantly, down the line, a longer tail of protection against hospitalization and death is provided by vaccination. And so we continue to recommend vaccination even for people who have previously had COVID.
Okay, thank you. All right. First question is, despite warnings like yours today, it seems harder and harder to get people to actually listen or act on COVID's potential future threat. Seems like many have tuned out and moved on. How do we deal with that? A lot of people think they've heard it all before. Any comment?
Well, I understand the sentiment. I think we've all, been at this for over 2 years now. And but that's why we're here today and why I'm saying these things. It's a call to action. And there's many things we have to do in life over and over again, whether it's, paying taxes or getting your teeth cleaned or responding to another surge in COVID. So I think we're all capable of it, and just I urge folks to pay attention and look at the numbers yourselves and think about your own well-being, those of that of those around you and the broader community. And I think this is a time for us to be grateful for the good stretch we've had since February or so, but it is time to kind of raise our guard again.
Yeah. I would think one of the sort of odd benefits of having gone through this is it no longer feels funny or is unusual to see people wearing masks in public. If we think back at the start of the pandemic, first time we had to go into someplace wearing masks, it felt a little odd and difficult, but it soon became quite normal and comfortable. And still in grocery stores and other places, you see a significant portion of the people wearing masks, and it's no longer a shock. So I'm hopeful that people will take advice, particularly if they're in crowded places, and think of others as well as themselves, and mask up. So I don't know what more to do than provide people with good information, make our recommendations as strongly as we can, recognize the virus is still a threat to many, many, many people, and hope they do the right thing. So that's how we have to approach it. Okay, what do you see as the future of COVID vaccinations? Mandated versus voluntary, for kids, for adults, once a year like a flu shot? Doctor?
Well, there's a lot there. Certainly for now, I really want to focus on what we know now, which is that vaccination protects very well against hospitalization, severe disease, intensive care unit admission, and death. And so being fully vaccinated and up to date on your boosters provides strong protection against that. Even if over time, the protection against infection wanes. I got boosted about a month ago, and I'm more protected now against infection than I will be in 4 to 5 months. But the protection against hospitalization, severe illness, 4 to 5 months down the line will still be very good. And, the future of this vaccination regime, if you will, and how frequently we need to be boosted, it really remains to be determined. And I want to leave that in the hands of the scientists doing the work. But it's conceivable that we will have to periodically get boosted in order to restore a high enough level of immunity to protect ourselves, others, and the healthcare system. Certainly, I hope in the very long run, we come up with a vaccine that, you get it once and you're good for life, more like we do for measles and chickenpox, say. But that's not in our hands right now. And I'm sharing with you the information we do have, which is that vaccination is voluntary, it's recommended, and there are clear guidance for individuals to follow, and that the benefits to the individual are overwhelmingly positive. And so I encourage folks to get vaccinated, stay up to date, and pay attention and follow recommendations as they evolve.
Next question, where does more of the federal money the county still has not distributed need to go most now? I'll start on that one. So as you know, we've have received one first wave of federal Recovery Act funds of $80 million. We've been working with the county council and others to get that distributed. The $5 million I talked about a few minutes ago for small businesses is part of that, but it's also gone to still this past year, some response to COVID. And as we phase out of that, it's going more and more to businesses, really trying to make sure we're making long-term investments. So we're looking at stabilizing their sheltering capacity, making sure our organizations in the county are set up for future issues. The second tranche, as they call it, of $80 million, we have not received yet. So currently our Office of Recovery in Snohomish County is going out and meeting with all our mayors and organizations, asking for ideas and priorities from around the county. So those decisions have not been made yet. But again, we'll be looking for making sure that the dollars go to really increasing our resilience for future, whether it's pandemic or whatever we face, but resilience of our communities. So business support, sheltering, there's a lot of requirements in the federal dollars that we have to stay within. So that planning is ongoing now. Stay tuned as we receive that second tranche and do the planning. So we'll have more information in probably a couple months about exactly where we see the priorities. Again, we're getting ideas from a lot of places. So, Doctor, do you have anything to add to that?
Well, no, I mean, I think that's the health district's activities that are clinical in nature have largely been scaled down and are transitioning back to the healthcare system for the long term, because as I mentioned earlier, I think, the last wave definitely wasn't the last wave. We're in this one, and this may not be the last one either. We need to have a sustained response over time that really is integrated with people's healthcare. And so that's the direction that the clinical activities are taking. And then we continue with surveillance, education, and that type of work, and coordinating efforts or working to help the healthcare system coordinate efforts in a way that meets public health interests. And so, we're supportive of the way the county is allocating the dollars at this time.
Okay, next question. CD's website still has our county in the green or low category. Are we kind of teetering on the edge, or is the CDC site just not updated?
No, we're clearly, I think maybe they just haven't updated. There are 3 factors that go into it. If I may, I'll just very briefly share my screen again to show you that graphic. So here we are with 335 cases per 100,000 per 7 days. I suspect that metric hasn't made it into their system yet, but so we're above 200 cases per 100,000. So even though our hospital admission rate is less than 10 per 100,000 per week, and the hospital census is less than 10%, just by virtue of that high rate, we push into the medium risk category. And then a further increase in hospitalizations. We've gone from 2 per 100,000 to 5 per 100,000 per week over the last month. And if we don't curb transmission, we will see hospitalizations go up into that high range. And not only the rate of new admissions, but the total number of people in the hospital will begin to exceed 10% of the total. And you'll recall, with Omicron, we got up to about 35% of hospital beds in the county filled with COVID patients. And that just not only creates chaos in the healthcare system, but it obstructs access to care for all conditions. And that's what what I'd love to see is for this to be the peak right now, and we can stop, see transmission go down, or at least level off and forestall or escape a healthcare surge.
Great. And follow-up, are we still hearing from hospitals that they're struggling with staffing issues? Has that situation gotten any better?
Yeah, that's an ongoing issue, and also we're hearing from our emergency medical service colleagues that there's a certain metric called offloading time when you arrive to the emergency department and deliver the patient and report off to the healthcare team there, clean up, get your unit back out in the field to help the next person. And those offload times are lengthening. And that's another signal of stress inside the hospital, because what slows down the offloading is our capacity issues in the emergency department and in the hospital itself. So it's again another signal that of the system having stress. So here we are, and I'd say I'd like us to heed the early warnings we're getting to try to avoid the bigger crises that we've faced in the past.
Okay, and last question I see we have up, are we looking at any modeling for when this wave may peak, or is it too early still? It's been a while since I've looked at the UW modeling site, but what do we know?
Correct, Executive Summers, and they haven't issued a new modeling report since back in the Omicron wave, but I did hear from our state colleagues that they're working on that and anticipate something coming out in the near future, but I haven't seen anything nor heard of any preview comments about what they're seeing.
So too early to tell.
Yeah.
All right, any other questions?
All right, well, it looks like we've gotten all the questions that were in the chat so far. So thank you all so much for joining us this morning. Please do stay tuned. We will send out advisories for any future media availabilities, and we appreciate you joining us this morning. Have a great day.